Hi, Kate Grace, physical therapist in San Diego. I'm going to show you guys a patellofemoral exam because you requested information about the OnTrack. Well, as anything we do in orthopedics, it starts with a really good exam. So you've already taken your history of the patient, you've already done all the other objective exams, so now I'm going to do a very specific patellofemoral exam to determine where the patella is so you guys can decide when you apply the OnTrack how you're going to use the strap to make the corrections. So the first thing you want to do is, as you come over and look at the patella, we're going to look at her left knee. What you want to do is first get a good sense of exactly where the patella sits and lies on the knee. And for people that are just starting, what I'd like you to do is first get the leg in femoral neutral rotation, so they're not rotated at all, and then go ahead and sit up against the leg so it's nice and straight. Then the next thing you want to do is you want to find the parameters of the patella. And so here's the superior portion, medial, lateral, and inferior, and put a mark right there in the middle of the knee. Patients won't mind that too much, and it'll give you a good sense of where to go to when you evaluate them. So what we're going to first determine is whether or not the patella has a glide. So pretend this is the patella, this is a lateral glide, this is a medial glide. So we're going to determine where that patella is sitting in relation to the femur. How you're going to do that is you're going to take your fingers and you go up on the thigh, you're going to come down until you hit the bony landmark, which would be the epicondyles. Hold them there and take your fingers right to the middle of the patella where you've already marked it. The space between each of my thumbs and fingers should be equal. If they're equal, they don't have a glide. If my fingers are over here, that means there's a lateral glide. If they're over here, they're a medial glide. So that's the first measure we're going to take. The next measure we're going to take is whether or not she has a medial or lateral tilt. This would be a lateral tilt, which is by far the most common, and this would be a medial tilt. So how we're going to determine that is you're going to take your finger, you're going to palpate under the medial and lateral borders of her patella facets, medial and lateral facets, as they come in contact or close to the condyles. So this finger over here, I'm measuring the medial space between the medial facet and medial femoral condyle, and the lateral over here, lateral facet, lateral femoral condyle. They should approach the same distance just about, but because the lateral femoral condyle should be taller and bigger than the medial side to stop the patella from going laterally, you may find a little less space over here. But in general, if this space is less than 50% of over here, that indicates a lateral tilt, which would be in this position. So that would be your next evaluation you're going to do on the patella. The next one will be determine whether or not, and if you want to look at the little bottom piece of this tape measure, let's pretend that's the inferior pole of the patella. You want to determine whether or not the patella is sitting normal or whether it's got an external rotation, which will be that way, or an internal rotation, which would be that way. How you're going to do that is you're going to enlist the help of the patient, and you're going to put the tape measure right up on the inferior, the distal end of the ASIS. You're not going to look at this space anymore. You're going to come down and palpate the medial and lateral borders of the patella, the superior border of the patella, and the inferior pole. You're going to look at that line down there, and you can look at the schematics on our website, which I'll give you when we're done, and on our brochures. But this should be a straight line from the middle of the superior border to the inferior pole of the patella. Then you're going to pull the tape measure down right through the middle of the femur, and it should bisect that line right there between your fingers. So far, this is our current resident, and she doesn't have any patellofemoral malalignments, so this is straight. If, for example, my finger, if I'm going to palpate my thumb down in the inferior border, it's over there, and I draw a straight line down her femur, that would be an external rotation. Or if her inferior pole was over here, and I drew a straight line down her femur, that would be a medial or internal rotation. So that would be rotational component. And then there's one more component, and what you're going to do is you're going to come down and look down here. Mark, you have to get down there. And you're going to look at whether or not she has an AP or not. So let's pretend this is her patella. So an AP would mean the inferior pole is going from the anterior to the posterior segment of the leg. So anterior to posterior. Now there's a little bit of an anterior-posterior on the patella anyway because there's more bone density on the top versus the bottom. But you're looking for something that's a little more extreme like that, which also, as the inferior pole goes down toward in the fat pads, it kind of makes the fat pads appear inflamed. So this would be pretty large in AP. What you want to do is put your fingers on the middle of superior border, inferior pole, and then look right across to see. Now this is normal, so there's just a little bit of an AP. This would be not normal. So that's what you're looking for there. So those are the 4 malalignments you want to look for in the patella. Then we want to see how she does actively. So we're going to come back up and look at the top of the patella. And we're going to put our fingers right on the medial and lateral borders of the patella. And we're not going to influence it in any way, but we're going to ask her to do a quad set and watch which way the patella goes. So go ahead and do a quad set. Now she does have a little bit of a lateral motion when she's active, so relax. Okay, so see if you can see my fingers. It's a little hard to tell, but go ahead and contract. See how she's not touching this finger over here at all, but she's really pushing hard into this finger. Her patella is going laterally as she comes up, so she does have a little bit of a lateral glide as she's active. Come back up. Now I'm going to start one more time with my fingers on her patellas and go ahead and contract. And see how she is not in contact with my finger at all over here, and she's pushing into this one. So that would be an active lateral glide. So what you need to do is you need to determine which malalignments they have, and how you're going to fix them. 2 other tests that are important in looking at the patellofemoral joint is a glide. So what you can do is the same thing we did there with the quad contraction. You're going to take the patella and you're going to give it a little bit of an inferior glide, and you're going to ask her to contract her quad and relax, and make sure you don't compress the patella, but go ahead and just glide it distally and contract. If that hurts, or you get some grinding or cracking, or she's unable to do it, that's a positive grind test, and that means that they've already worn away some of their patella cartilage. The last test that I'll go over specific to the patellofemoral joint is apprehension. What you want to do is come here and put their leg over your leg. And you want it mostly extension. You can be slight flexion. What you're going to do is you're going to put your fingers on the medial border of the patella and start very easily. And what you're going to do is you're going to push out. And keep your leg relaxed. And if they say, oh, that's uncomfortable, or I don't like that, or that makes me nervous, that is a positive apprehension test. And that is for someone who may either have already said they had a subluxation or dislocation, or they're set up to have one. So if you get a positive test with this, then you want to make sure that you start all their exercise way down in flexion so they don't have a chance to come up and dislocate. And then the last thing you're going to do before you treat them, and you'll see on our next video the treatment for it, the application of the OnTrack, how to do that, is you have to do what's called a comparable sign. And what you have to do is you have to then reproduce their pain. And so then when you put the OnTrack on and apply it correctly, then you'll eliminate their pain. And you should be able to eliminate their pain day 1 in physical therapy. If you don't, then something's wrong. So what we would do with her is, I think it's good to start with a easier test than a harder test on the patient. So I start with a concentric test, then I go to an eccentric test. So what we might want to do with her next is come on up and, we don't have a step right here, do we? Come on over here. Can you follow us, Mark? Okay.
Yes.
Thanks. Here we go. Good to see a little of our clinic. So what we're going to do here is go ahead and stand here. And so what we're going to do first, Mark, is we're going to do a step up. So what you want to tell the patient is you may not push off the opposite leg and you may not lean forward. So what she's going to do is she's going to slowly step up and stop when she gets to the top. You put that foot down. And then what you want to do is you ask them, is that painful or is it not painful? If they say yes, that's the pain I've been having, then you stop there. You don't do any more. That's your test. Go down, apply the OnTrack, come back, do the same test, and their pain should be gone. Then what you can do is move on to the rest of the parts of the treatment. If that doesn't hurt, then I would go to eccentric, and I would do a step down. So step down nice and slow, just like you did before. Step down to the floor. That would be the next step. If she says, no, I didn't get that, spread your legs apart. Let's do a squat. So then we should do a bilateral squat. Come on up. She says, no, that doesn't hurt. We can do a bilateral, a single leg squat down there, etc. So you can go, you can do a hop, you can run, there's always a way to get your comparable sign. Do this. Next, we'll show you the video on the application of the OnTrack. Just keep one thing in mind, that this is one part of a whole system of treatment. This OnTrack, so far, is the only system designed to actually change the anatomy of the patella. So your goal in this first part is to change the anatomy of the patella, get it tracking properly, eliminate their pain, and then you can do all the manual therapy work, stretch out the lateral retinaculum, address the hip, the foot, all the strengthening program while their knee is tracking properly. So this is just the first part and one part of the system, and then we'll move on. We'll show you how to apply the OnTrack next and do the comparable sign and eliminate your patient's pain. If you have any questions, we are always available to talk to you, answer questions. If you have questions as a group, for example, just call me up and put me on speakerphone and I'll answer your questions for you. Make sure you go to our website. It's OnTrack.com, OnTrackBrace.com, and there's research there, and there's a lot of questions and answers on there that might help you too. But don't hesitate to call us and use this as a resource, and you can find our phone numbers and information on our website as well. Thanks, good luck. Let us know how you're doing.